Hi, my name is Maria Belén Villalta, and my topic is a prospective study of pelvic floor physical therapy, pain and psychosexual outcomes in Provoke vestibulodynia. Definition: the increased tension in the pelvic floor muscles of women with Provoke vestibulodynia play an important role in maintaining and exacerbating their pain. However, no prospective studies of pelvic floor physical therapy for PVD have been carried out.
Your pelvic floor muscles are a group of muscles that make up the base of your pelvis. This hammock of muscles helps support your internal organs, including the bladder and rectum. The bladder and rectal outlets pass through the pelvic floor muscles. The rectal outlet or anal canal is surrounded by the anal sphincter, a circular muscle which you release and tighten to control the opening and closing of the outlet. The puborectalis muscle works together with the anal sphincter. When stool moves down into the rectum, it triggers an urge for a bowel movement. When you sit on the toilet, your pelvic floor muscles relax. This relaxation causes the puborectalis muscle and the anal sphincter to release, opening the rectal outlet and allowing stool to pass easily from the rectum. These muscles are under your voluntary control, meaning you control when they open and close. Pelvic floor dyssynergia is a lack of coordination in the muscles during a bowel movement. Instead of releasing, these muscles either do not relax or they tighten and close off the opening. This makes it very difficult to pass stool and may result in a feeling of blockage at the outlet, passage of narrow stools, or incomplete emptying of the rectum. It is not always known why a person may experience dyssynergia. Treatment in the Mayo Clinic program focuses on learning how to relax the muscles that control the ability to pass a bowel movement.
Application in physical therapy. Following treatment, participants had significantly higher vestibular pain thresholds and significantly lower pain ratings during the gynecological examination. Pros and cons. Pros: overall sexual function significantly improved. Cons: participants' mental health did not significantly improve.
Hi, my name is Daisy Doherty, and I'm a doctor of physical therapy here at St. James, and I'd like to talk a little bit about pelvic floor physical therapy. So pelvic floor PT is specialized treatment for the pelvic region. So you have muscles that attach right at the pelvis, and they support your bowel and bladder as well as aid in sexual function. So when you have these muscles and they become too weak or too tight, this can contribute to symptoms that lead to urinary incontinence or even pain with sexual intercourse. So we do treat women of all ages, whether that's childbearing years all the way up to postmenopausal. As you can see, many different diagnoses all the way from those years, such as pelvic organ prolapse, urinary incontinence and frequency, and many more. So during treatment, the goal is to really find out what is the root cause of your symptoms. And we really want to find the appropriate plan of care. So that might include manual treatment, breathing techniques, and showing you some therapeutic exercises that can really find out and improve the limitations that you're having. Treatment time for each patient is going to be different. It's not a one-size-fits-all treatment plan. Some people may start to see improvements in their urinary frequency or incontinence within 1 to 2 sessions. Other people, it might take a little bit longer. It really just depends on what you're coming for. So what really got me interested in women's health and pelvic PT was actually having a conversation with my colleague Christine. When I first started as a relatively new grad, she had told me about the continuing education that she had already done. So it really got the ball rolling for me. And the more I learned about it, the more I found out of how common it is for people to have these symptoms and You know, it's so common and it shouldn't be something that you're embarrassed to go get treatment for because it's your daily life. You know, you want to take charge of that and really get the treatment that you need. And I'm just happy to be able to provide that for people.
Issue applied in Ecuador. In Ecuador, physical therapy treatments are beneficial in the management of chronic pelvic pain. Of all of them, the one that is most effective in reducing pain is electrotherapy. In addition, they also improve other aspects such as quality of life. Conclusion. The results provide preliminary support for the effectiveness of physical therapy treating the pain of PVD, as well as some of the sexual and cognitive correlates of PVD. The results also indicate the need for large-scale, randomized studies of the effectiveness of physical therapy in comparison and in conjunction with other treatment options.